One of the important parts of healthcare during the teenage years is transition. And that means learning about how to get the healthcare that you need and you want, how to navigate a complicated healthcare system. And it's something that we like to do with our patients between the ages of 12 and 21. One of the first steps that we're going to encourage you to do is to take the initiative when you come in for an appointment. You should talk with the person at the front desk. They're going to ask you your full name and your date of birth. They're going to ask you to provide your insurance card if you have one. And they're going to probably collect some initial information, your address, who's responsible for your bills, and other things like that. When a healthcare visit begins, you're going to be asked a lot of information. We're going to start by asking you about your past medical history, any illnesses, chronic diseases. We're going to ask you about any surgeries you had and when those occurred. We'll ask about family history. We'll start by asking you about your parents and your siblings and then your grandparents. Now, a step-parent's medical history is not what we will be asking you about. So that's important for us to know. We'll also start to ask you questions about your social history. Do you smoke cigarettes? Have you ever smoked? Do you ever drink alcohol? Have you ever experienced blackouts? Have you ever used illegal drugs like marijuana or cocaine? Or have you ever used prescription drugs but used them for not the intended purpose? We'll also ask you about where you go to school and what kind of activities you're involved in. And we try to get to know you as well as we can so that we can help plan your medical care appropriately. One of the areas that we'll ask you about when we talk about your past medical history is whether you've ever had an allergic reaction to a medicine. This is important for us to know because we don't want to prescribe that medication, or we want to help you figure out if you truly do have an allergy. We're also going to ask you about allergies to other things like peanuts or bees. And those are important because we would want you to have emergency medication on hand if you ever got exposed to something that you had a life-threatening reaction to. There are a lot of questions we're going to ask you about during your visit. One of the questions is going to be which medications you take, what the dosage is, and why you take it. When a prescription is written for you, there may or may not be refills on that prescription. So you can look at the bottle and you can read and you'll see whether or not you can refill that prescription. To do that, you don't need to call your provider each month. You can call the phone number of the pharmacy, and through their automated system, you can request a refill for your medication. During the teenage years, you're going to often be asked to spend some time with your provider alone, and your parents will be asked to step out. This is an important time for you to develop some skill and some comfort talking with your healthcare provider. This is not about secrets or not including your parents in your care. Rather, it's giving you an opportunity to have a voice and to ask important questions and to get important health information. Each year, you'll be asked to take on more and more responsibility. We really want to make sure you understand what's going on with your body so that when you're an adult, you'll feel very comfortable with this process. Sometimes we will ask you very personal questions when you come in for health care. We might ask you about your sexual health, whether or not you've been sexually active. We might ask you questions about gender identity and your comfort with your body. We might ask you what you do to prevent STDs or to prevent pregnancy. That's also a very important part of your health care during the teenage years. Part of the Affordable Care Act included giving patients the opportunity to look at their own medical records. Once you turn 18, that information is available to you and not to anybody else. Your parents can no longer access your medical information. At UVA, we have a system called MyChart, and we will show you how to sign up for that. You can go into your own medical record, look at lab tests, look at x-rays, make sure the information is correct, and you can communicate with your healthcare provider directly through that computer system. At some point, you'll be leaving an adolescent practice and getting care from an adult provider, and you might be confused about where to go next. The first thing you should do is talk with your family, talk with friends, and find out who they're seeing and how they like those providers. You could also make an initial appointment and interview a provider to make sure that it's a good fit, that you feel comfortable in the office, you feel like you can ask the questions that you need to ask, and that you get good information back. Thank you for taking a few minutes to listen to this video. We hope it helps you start to think about what your adult healthcare life will be like, and that transition will go smoothly.